Hello, everyone. We're really excited to be here today. One of the biggest problems facing our youth today is prescription drugs. One thing happens is kids start smoking marijuana. They think, oh, a pill's not a big deal. It's, medication. It's not a problem. And they start using them. The problem is they go straight from those to heroin. It sounds like one of those scare tactics, but that's what's really happening today. And we have a couple of really wonderful young students that will be doing the presentation today. We have Mia Montez from San Diego Alliance for Drug-Free Youth, and Jesus Manzano from North Coastal Youth Prevention Coalition, and they will be doing the presentation about the power of grandparents and how important you guys are in this fight against prescription drugs. So I'd like to invite them up right now. Oh, a little bit later, we hope to have a Dr. Jorge Gaspar from Vista Community Clinic come here and also talk about interactions between alcohol and prescription drugs and prescription drugs themselves. So here we go.
Thank you so much. Okay. So like earlier said, hi, I'm Mia Montez. It's a pleasure to meet you all. I graduated from San Diego Academy a couple weeks ago, and I plan on attending Mira Costa College in the fall as a student ambassador and majoring in English Literature Studies. Thank you. Thank you. Thank you.
Good morning, my name is Jesus Manzano. I graduated from El Camino High School about a month ago. I will be attending UCLA in the fall with a major in political science. Okay. And now we're going to get this presentation started. So, the danger of prescription drug abuse. Prescription drugs are important because they help relieve one of pain, they help relieve one of stress, etc. But they have also become a growing problem in our community and throughout communities across the nation because they are being misused and because they are being abused.
So taking a look at this chart, you can see that marijuana is the most commonly abused drug, but right after that comes the prescription painkillers such as Vicodin, Oxycontin, and many others. And those are being mostly abused by high school students and even kids younger than high school aged. And then the real scary statistics about this is that about 1 in 9 youth have used prescription drugs in the last year for illegal purposes. And then from that test group, from the 1 in 9 youth, the people who have used it, who are about the age of 13 or younger, will later in life have an addiction to something such as alcohol or prescription drugs.
So you may be asking yourselves, why is this relevant? Does this really happen in San Diego County? Well, as you can see from the chart, in 2013 alone, there were more deaths because of prescription drug abuse than there were deaths associated because of reckless driving. So when you look at it, it's scary, isn't it? It's scary that more people, more youth are dying because of the misuse of prescription drugs that are supposed to keep us healthy than they are of reckless driving.
And now some of the most abused prescription drugs, hydrocodone, which is commonly used as Vicodin. This is a moderate to severe pain reliever. And after that is oxycodone, which is known as Oxycontin, which is a high potential for abuse, and it's a muscle relaxer. And after that is codeine, which is commonly found in Tylenol. It's a little harder to find, but it is available. And it's for it's a respiratory depressant, similar to morphine. And then last but not least is benzodiazepines, which is known for Valium and Xanax, which is prescribed for anxiety and sleep problems. But out of these four, the one that is most commonly abused is Oxycontin because it's easy to get your hands on, but it's an expensive pill. So once the pills run out, teens usually end up going to heroin because it's a much cheaper alternative, and so there's no middle ground between Oxycontin and heroin. It's just one from to the other, and heroin is highly addictive and hard to get off of.
And the reason why most teens go from OxyContin to heroin is because heroin provides the same feeling, but it's much, much cheaper. So you get the same feeling, the same rush, the same high, but at a lower price. So that's why there's no middle ground. It typically goes from OxyContin to heroin. Okay, so now about you. What can you do? How are you important? Well, your role as a grandparent is an important one because you have a little more leverage over your grandkids than your children, so their parents may have. Grandparents are such powerful allies, and they can really help keep the kids off drugs.
And why kids love their grandparents so much? Well, I know that I love my grandma so much because we're able to just hang out and have a good time. And not only that, but she listens to me and she takes the time that maybe my mom won't have for me and really just focuses on the positive. And also she always brings like some good cookies, so that definitely does add to it.
Okay, next one. The power of a grandparent. So bottom line is that grandparents are cool and relaxed, and that's what that said. So I'm doing a good job at reading and memorizing. No, but really, grandparents are important allies to keep kids off drugs. Grandparents get along with their kids and with their kids better typically. Sometimes the children may hate their parents, they may get upset at them, they may have arguments with them, but I can't remember getting in arguments with my grandparents. So grandparents just have more of a say with their grandchildren, and grandchildren typically listen to their grandparents far more than their parents because they see them as wiser, they see them as having more experience, and they see them as more of a friend than an enemy that's always on their case.
Exactly, like how Jesus said that we'll always love our grandparents. So it's important to spend time with your grandchildren. And I know that can seem like, oh no, what am I going to do with them? Because there's a generation gap. But it's a myth. There is no generation gap. It's just finding activities that both you and your grandchild will both love. And so I know what I like to do with my grandma is usually we bake together. And so that's definitely one of the things that we do bond over. And it opens up a pathway so that we can both talk and communicate in an easy, relaxed way. So there are definitely ways to communicate with your grandchild. It can be over baking or watching a TV show or as simply as going on a walk together.
And like Mia, I also like spending time with my grandparents. And one of the most meaningful activities that I like to do with my grandmother is read to her and talk to her because my grandmother is blind. So we interact and we bond over that. I read her the paper and she talks to me, and it's a good way to connect, definitely. Another thing that you can do is teach your grandchildren about the old-fashioned things, quote unquote, that have been lost. Those skills such as writing a letter, writing a check, teaching them many ways of how you used to communicate. And one thing that they can do to you is teach you to get all tech savvy with the innovations in the technological world. Sometimes it's hard to keep up, but kids, they keep up very well, so they can definitely teach you something new about technology each and every day. And just as that, you can teach them skills that they may not have learned at school.
So checking your medicine cabinets, that's a really important thing to do, and to keep inventory because, as you get older, you have lots of medications, and sometimes it's just hard to keep track of it all. But the importance of keeping inventory is to make sure that you're not losing any and to make sure that they're all up to date. Because I know we all have guests over at our house, be they younger or older guests, and sometimes those people may go into your cabinets. So it's definitely important to keep track of what you have and to keep it stored and locked away in a personal place that no one can get to.
Okay, and I don't want to leave this as implicit as it's sounding right now. The reason why we're doing this presentation is because many youth have been taking medicine from their grandparents. They have been taking medicine for their use or to sell. So that is why we're here. I don't want to, leave it very vague. That is the issue that's happening. And that is why we're here, because it's very important. And while we know that, your grandchildren may not be the ones that are taking it, the point is that you may have a friend whose grandchildren are taking it from them. So it's good to keep educated. And as we can observe from the chart, the source in over 70% of times of illegal prescription drug abuse has been friends and family. That means that in over 70% of the times, the kids have gotten the drugs from their medicine cabinets of their grandparents.
Disposing of your prescription drugs. I do appreciate how Jesus really tied it up, because I know that there are a lot of kids who just want to help their friends, but you have to educate them that this isn't the way to help them. So disposing of your old drugs properly. Please don't flush them down the toilet or down the sink, because from that it goes into our water system and ends up in our bodies again. So we do have some ways to dispose of them. In the back, we do have a police officer where you can leave your prescription drugs with them that are no longer of use to you, or if they're old. And then if you're not able to do that, we do have a statewide prescription drug abuse drop-off day, which is September 26th.
And if you can't make it to National Take Back Day, there are also many permanent locations where you can drop off your non-used prescription drugs. For example, in Carlsbad, Vista, Encinitas, and Oceanside. And I'll give you a second to jot these down or take a picture of them if you'd like. But yeah, like Mia said, it's very important to dispose of your drugs in a manner that is good, that is appropriate. We definitely don't want them getting in our water stream, because that not only pollutes the ecosystem, but it's also irresponsible.
Okay. Oh, I need the kids.
I'm here to give you a little small talk about the power of grandparents and the important roles you all can play when trying to stop prescription drug abuse, specifically in our youth, teenage, and young adult population. Because it is an epidemic that's going on around right now. Pain management is very specific in terms of what we as doctors use them for our patients. Oh, thank you. But the gist of it is that pain management is very difficult, because me as an orthopedic surgeon, whenever we operate on somebody and they're having pain after their surgery, we want to make them feel comfortable, right? We don't want them to be in pain. We don't want them to we want them to come back to us. We don't want them to go somewhere else because somebody was going to give them more pain pills. And no, that's not the right thing to do. The only problem is that sometimes you guys don't need that many pain pills. You need maybe only 2 or 3 to tide you over for a couple of days, but the prescription comes in a month's supply, right? So now what do? The good and the reason I'm here today is to talk to you about how you can prevent those pills from falling into the wrong hands. More specifically, your grandchildren, the friends of your grandchildren, great-grandchildren if you have them, that could be the case. And to just simply prevent them from being taken and be used in a bad manner, either by being sold on the streets. Very common, by the way. Prescription drug abuse is the #1 problem we really have right now in high schools, and unfortunately in junior high schools now as well. So, if you leave them out, somebody will grab them. I can guarantee you that much. Somebody will grab them. Maybe it's not your grandchildren. You may have great-grandchildren, and that's great. You really trust them, and you communicate well with them, and that's okay. But they have friends, and some of their friends might come over to your house, and they might take them, and that's what we're here to let you know. To be really aware of where you keep your prescription drugs. The right answer to that question is you should dispose of them immediately. Did John show you the giant box that we have? It's back there. So if you feel you don't need that medication anymore, specifically pain medication, which is highly controlled substances, please either take them back to your clinic, because we can dispose of them as well for you, or find one of those boxes. The sheriff's department and the Oceanside Police Department generally hold these events where you can go and deposit any medication, not just prescription drugs, any medication that you're no longer going to be taking, and just get rid of them. There's there's no need to hold on to them for temptation's sake, unless you have a safe in your house and you're going to put them in the safe. But, you know, I never heard of a burglar to break into a safe looking for pills, but you never know. So you're better off just dropping them off and getting rid of them. Drug interactions, as the slide states, is also something we look out for in terms of prescription drug abuse, and as well as prescription drugs when you're taking them. So, has anybody here ever felt sick at one point, like in pain, and you just decided to reach into the cupboard and grab an Advil or a Tylenol? Anybody? I've done it. Nobody? Nobody grabs an Advil once in a while because of some sort of back pain or knee pain or hip pain, anything. You know, it's common. These are over-the-counter medications that you can buy at any store. Anybody here ever had leftover medication from a surgery? And I'm not singling anybody out. If you don't want to raise your hand, that's fine. But I've had instances where patients tell me, oh, you know, I was having really, really bad knee pain the other day, and the Advil just didn't cut it. And I was like, well, what did you do? Oh, well, you know, I had some leftover hydrocodone from back when I had this one thing happen to me at one point, and I just took it. And I was like, did you know how old that medication was, that hydrocodone was? No. Did you know what milligram? No. So you just took it. Yep. Oh, you know, that's really, as a provider, we really get stressed out when we hear that, because that means that I have absolutely no way of knowing that. Unless you bring me the pill bottle in itself, I have absolutely no way of knowing what that medication contains, what the dosage is, what were you given it for, right? There's a whole slew of things that could happen if you don't if you do that. Drug interactions is another big one. So let's say you're on a hypertensive medication for your blood pressure or for your blood sugar, and this happens to be the case. You decide to take a pain pill because you were feeling particularly bad at that moment that you had left over. It's really dangerous to do that because that medication could interact with the medications you're currently taking for your blood pressure or your glucose, and it could really throw you for a loop. It could really, really cause you harm. And then you might feel really bad afterwards, and instead of going to the doctor, you just decide to maybe just sleep it off or relax a little bit. Maybe you'll feel better in the long run. But that interaction already happened, and it's causing problems in your system, and we want to know about them. So, as it says up there, there's certain foods, beverages, alcohol, caffeine, cigarettes that can interact with medications or even supplements. So whenever we're going to prescribe to you any sort of controlled substance, doctors will usually will ask you, are you taking any medications? Medications include supplements, okay? So if you're taking any, we usually give valerian root to sleep, or if you're prone to taking, what's another common one? A lot of fish oil. St. John's wort, yes, for depression. And I've heard of ginkgo. I've heard, what else have I heard recently? Ginseng, that one I've heard too. Ginseng contains caffeine sometimes, by the way. Heads up on that. So don't drink 2 cups of coffee with a pill of ginseng, because then you'll probably be really wired for the rest of the afternoon. There's a lot of different supplements that are not regulated by the Food and Drug Administration. In fact, all of them aren't. They don't need to be regulated or to be sold. So just let us know if you're taking any supplements whenever we prescribe you any type of medication. I know this applies mainly to prescription drugs, but whenever we're about to prescribe you something, please let us know about the supplements you're currently taking. Even fish oil. Fish oil is actually, it's an omega-3, it's an oil. Oils naturally create barriers in your stomach and your intestinal lining. So if you take fish oil along with a medication that's supposed to be absorbed in the stomach, then it won't be absorbed in your stomach and it won't have any effect on you. That means it's not rare or uncommon to see patients who come in with blood pressures really through the roof, and when we're talking to them even more, they let loose that they've been on omega-3s because they saw it on Dr. Oz or something that it was great for blood pressure. And it turns out it's interacting negatively with their medication. And they never told us about it. And they've been doing it for 6 months, and that's really what concerns us the most. I just mentioned that medications can be less effective if you're taking it with certain things. Side effects, really big deal. Mention side effects to your doctor whenever you go visit them. If you take something, and I'll give you a little bit of a pharmacy lesson here. Medications take anywhere from half an hour to 1 hour to take effect, the majority of them. I'm not saying that's always the case, but 99% of medications, that's how long they take to be absorbed into our systems. So if you take a pill and within that hour you start feeling really, really bad, then it was probably caused by that pill. Make note of it, because you should mention it to your provider the next time you see them. Your doctor. Sorry, I say provider because that's what we call them at VCC. But your doctor at your next visit, because then they can determine if it really was a negative reaction to the medication, or it's just simply you were feeling gassy at that moment, right? But it's important that you tell us, because we'll make that determination. Don't make that determination yourselves, okay? So this one's a little bit harder, and it still works, though, if you manage to really keep a good track of whatever medications you're taking. To reduce the risk of people stealing your things, or if they steal them that you know about it, the best thing to do is to keep a list of them, right? If I know what's in a certain drawer and I inventory it every so often, then if one day I show up and there's 3 things missing, I'll know about it, right? Because I'm keeping a regular inventory of it. The same thing applies with medications. You don't have to do it for all of your medications, but really the ones, if it's a controlled substance, you really, really should be aware of 2 really important things. 1, what the medication's name is, and 2, how many you have left. If I were to just to randomly call on somebody who's taking any type of medications, would you know how many pills you have left of a certain kind? No? Maybe some say yes, no? And the reason is we usually don't think to do that. You know, I have some folks who have a really nice week planner where they have all their medications already set out for the week. That way they know if they're going to run out, right? Because that's really important. You don't want to be out without your meds. Same thing applies with controlled substances. You really want to keep track of how many medications you have left. If you have 5 pills left and the next day you come over and you see 4, well, what happened? Where'd that pill go? If the cat's asleep on the couch and can't wake up, then you know where the pill went. But it's really important to keep track of what you have and how many you have left. The next section is carefully follow the instructions on your medications, which is a huge deal. Don't auto-medicate yourselves in terms of, I know a little bit better, I'll take 1.5 because I feel really bad, and I'll just take a little bit more, or maybe I'll take a little bit less. Medications are prescribed a certain way for a reason. That reason being that it takes a certain amount in your blood in order for them to work. So if you don't reach that certain level in your blood because you're halving the dose, because you don't feel you need it, then you really have to let your doctor know that you're doing that, because it could potentially mean that the medication is not working for you because you're not taking it right, okay? And we really want to work with our patients in terms of what you guys are taking. So if you feel that you're taking too many pills, let your doctor know about it. Tell them, nowadays, pills are usually combined. So you have 3 or 4 medications in one pill. That way you don't have to take a whole slew of them in breakfast. Or, you know, you ever seen that? It's a funny picture where they show a bowl of Fruit Loops next to a bowl of pills. And they look almost exactly the same. And it ends up that a lot of people end up doing that, right? Taking a bowl of pills with breakfast. And let your doctor know if you're having trouble taking too many pills. And we'll be glad to help you out. Let them know if you drink or smoke alcohol, even occasionally. That's a really big deal for us. Nobody's saying you're an alcoholic. You know, if you have a nightcap every now and then, even daily, you know, right? Medical science has proven that a cup of wine at night is really good for your heart. For heart health. Red wine is really good for your heart. So if you do that, that's okay. Let us know. We'll be fine with it. But it just, when we prescribe to you, we'll really try to tailor it to the fact that you are having that little nightcap every now and then. And we won't give you medications that interact with that alcohol because it'll make you feel bad. We don't want to do that. If you do those things and you let us know, we have an obligation as medical providers to answer all of your questions. right? No matter how, I was going to say another word, but that doesn't sound very well. No matter how trivial you might think they might be, ask them. Ask the questions, right? If you have a doctor who goes, because you're asking questions again, get another doctor. Get another doctor. We're there to answer your questions. We're not there. You're not taking up our time. You're not. You're our patients, and you deserve the best that we have. So if you have a doctor who gets exasperated every time you ask questions, I'm not kidding, find yourself another doctor. Okay? Yep. Everybody following me well so far? Good, awesome. So one of the things that you'll be finding as we move forward with healthcare and the way it's transforming is that you'll get asked a whole bunch of questions now, right before your visit. A lot more than you used to before, maybe. Before we used to take maybe your blood pressure, your temperature, and that was it. Go see the doctor, you know, we're good to go. Nowadays, because healthcare has become such a large industry where it's expensive, we're really trying to find ways of mitigating that expense by trying to identify root cause of problems. So let me kind of exemplify what I mean. A patient comes in today and we ask them, they have asthma, by the way, I'm just gonna make this up. A patient has asthma coming in today to talk to us, and it turns out they've been recently in the hospital. They were in the hospital last week, and they were in the hospital 3 weeks before that because they had an asthma exacerbation. That means they had an asthma attack, okay? And when they come, before maybe you would come into a medical provider and they would take your vitals and, okay, here, take this inhaler, you'll feel better, and that would be it, right? That would be the extent of what we would do. Nowadays, there's a new model of healthcare that's really aimed at what we call the social determinants of health, and that's the fancy way of saying we really want to know what makes you tick and why all these issues are coming by. Why is this patient having an asthma exacerbation? So, then this is what I'm about to say is actually a real live case study. It happened in Los Angeles in a community clinic. The patient came in with the same thing I just told you about, multiple asthma attacks, and we have care coordinators in our clinics, and more clinics are having these people called they're called patient navigators. You ever heard of that term before? They have a bunch of different names, but the gist of it is that they're there to provide education to the patients, and they're there to help them with anything that they may need outside of the clinic. So what these folks in Los Angeles did is they actually went to the patient's house, right? This patient would be having these asthma attacks. They went to the patient's house, and what they found was that this lady and her kid were living in a one-room bedroom apartment that was run down, full of cockroaches, full of mold in the bathroom. The drug hadn't been changed in something like 20 some odd years. The drapes were all full of dust and full of dust mites. The owner of the apartment complex nobody even knew who he was basically at that point. So what they found out that this patient was having asthma attacks because of where they lived. That it really is the conditions that they were living in was causing this patient to have continuous asthma attacks and end up in the ER every other week. So they worked with the County of Los Angeles, and they got the tenant. I believe they had him put him in jail. I'm not quite sure, but for negligence. But they really worked with the County of Los Angeles to make sure that these patients had at least livable living conditions. And I'm happy to report that as of the last update I got on this case, no more asthma attacks. The patient was moved out to another place. The clinic helped them get another place to live that didn't have all these characteristics that were causing their attacks, and now they're better. I thought it was amazing. I really thought it was amazing that we were able to do something like that. So it's tying into the whole thing. Just let us know. We want to know a lot of things about you, and we're going to ask a lot of questions. Be patient, because there are going to be a lot of questions being asked. One of those questions is about the drugs that you're taking, and I just mentioned it right now about supplements. Let us know. We'd like to hear your story. We want to hear. We want to know everything about you. The more we know everything about you, the easier it is to treat any condition you might have or any problems you might have. Trust me on that. I'm a doctor. So if you have problems or you're experiencing side effects related to your conditions, I had already mentioned that, call your healthcare doctor right away. Let us know. A phone call, how long does a phone call take? Well, okay. Let me rephrase that question. How long is it? Yeah, because you can be on hold for a while. But telling your doctor about something maybe takes a good 10 to 15 minutes of your time, right? It does. And you have to call and you have to wait for them to pick up and so on and so forth. But if you don't call and that side effect ends up being something that's life-threatening, I think that's a little bit, it's worth wasting 15 minutes of your day in order to just get clarification on anything you might have, okay?